Let's go next to Chris from San Antonio. You were on the air. Chris from San Antonio, you were on the air.
Hey, David, can you hear me?
Hey, yes, I can.
Hey, how's it going?
Doing well.
Good. So I've been listening to your show a long time. Appreciate it to be on. I guess I'd consider myself progressive, but I do take some issues, I guess, with some of just the thought pattern that some progressives have. Like in terms of like, just for example, like Medicare for all, like I do think that's a good idea and I do support that, but I don't think it's like it's going to fix all the problems, I guess I would say, with the healthcare system in the country. It's really health insurance is Medicare for all. And, coming from a medical background, 80 to 90% of the diseases in the country are preventable. It's, mostly related to diet and things like that.
Is it that high? I mean, I know it's significant, but I've never heard 80 to 90%.
That's the figure I've heard. I mean, it's really looking at diabetes, hypertension, heart disease, those type of things where, the American diet is just so bad.
Yep.
That it's really causing a lot of those problems. And unfortunately, if we have Medicare for all, I just feel like it's going to exacerbate, people's bad, health decisions.
So I don't think Medicare for all will exacerbate people's bad health decisions. I do agree with you that Medicare for all is neither a panacea nor the only way to go about getting people universal coverage. I think it's one way to do it. I think there's other countries that have other systems that work quite well. And what I tell people is for me, this isn't partisan in any way. I just want the best solution. And one of the best books, I think, to read about how Medicare for all is one option, but there are others that around the world work as well. Uwe Reinhardt's last book, which I think was actually published posthumously by his widow, is one of the best books for explaining the balance that any healthcare system has to find on a triangle between access, quality, and cost. Every system is just picking a point on a triangle between those three axes, so to speak. And there's nothing magical about Medicare for all. In that sense, I agree with you. It's one way to go about it.
Yeah, what I would love to see more focus on is preventative care in the country.
Of course.
So, like, just for example, why couldn't there be, food stamps for all that can only be used for, the most scientifically proven healthy foods in the country?
Yeah, that's not the way I would go. No, the problem is when we start saying, because then you get into food stamps can't be used for ketchup because it's processed. I think that's micro. I think we need a macro strategy of, like, for example, shifting to where health providers are paid for keeping people healthy rather than being paid for the number of things they do to a patient. That's like a macro change. It's less about controlling what food stamps can be used for. I disagree with you there, respectfully, of course.
No, yeah, I understand that. Yeah, and it's, obviously the politicians are going to be responsible for the people, and if people just say, no, I want to eat this,
right.
It's not going to go well for them. So, I mean, I understand that, but I do wish also progressives would focus a little bit more on the meat, dairy, egg industry, because I do think it really correlates to a lot of things progressive care about, the environment, healthcare, just living conditions, both for, the people, that are working in those fields, as well as, the animals, or just, all that's just all swept under the rug. And, the average person really doesn't, understand where their food comes from. So I just kind of wish progressives would take that battle on. But
I would encourage people to read Michael Pollan's books on the food industry and these things, and things keep pointing to not eating factory foods, buying ingredients rather than food products, and having a modest amount of certain types of meats in your diet. Over time, all these diets come in and out of favor, but really we just continue getting more and more evidence of the things we suspected 20, 30 years ago.
Right. Yeah. Yep. And the final point I would love to see is, smoking really dropped down once, there were warnings were put on the packages. I think that's a route they could go with meat products. Considering they are considered class 1 carcinogens. So if you
Yeah,
put
I don't know about
a
that. I
label
know
on
that
every,
I know that bacon has been definitively shown, if I recall correctly, to maybe be carcinogenic. I want to make sure I'm being careful in what I say. But
yeah, there
some of
was
the
a
healthiest diets around the world contain, modest amounts of meat. So I think we want to be careful
right.
about these broad sweeping statements.
Right. Yeah, I think there was a 2015. The World Health Organization did classify any deli meat, so that includes hot dogs, any sliced meats, class 1 carcinogens, 1A or something like that. So it's like the same category as smoking, and
I would
it's
stay
not.
away from the
It's
processed meats. Absolutely.
yeah,
Absolutely. All
yeah.
right, my friend.
Well, I
Thank you so
appreciate the
much
call.
for the call. Chris from San Antonio. Glad to have been able to speak to a few folks today. Our guest canceled. That's not good. But then I got to speak to a few of you, which is great. We're going to take a break and we will be back with more right after this.